Good morning. Today I will be talking on the impact of demographic factors on the awareness and knowledge of glaucoma amongst patients of primary open-angle glaucoma, a cross-sectional questionnaire-based study. Dr. Ernie Bowling says that the diagnostic and the treatment modalities may be the best we have, but they would still be futile if patients are not aware and have scanty knowledge of their disease, as they would not be compliant to treatment and follow-ups. The objective of our study was to evaluate awareness and knowledge of glaucoma amongst patients of primary open-angle glaucoma aged 18 years and above, and to correlate these findings with the demographic data. So glaucoma accounts for 1/5 of the global blindness and is the leading cause of irreversible blindness world over. It is a silent scavenger of vision. 67% of open-angle glaucoma is medically managed, while 5 to 36% patients need surgery. So better awareness and knowledge ensures compliance to treatment, family screening, and follow-ups. Our aim was to assess the current levels of awareness amongst patients of open-angle glaucoma, thereby paving way for the development of targeted information, education, and communication strategies, and fill the gap and inform the strategies to enhance patient motivation towards treatment. So it was a cross-sectional questionnaire-based study conducted at a tertiary care center between 2020 and 2023, where all diagnosed cases of open-angle glaucoma were included, aged above 18 years, and the exclusion criteria were patients who were unwilling to participate in the study, patients with psychiatric illness, and other ocular comorbidities. A well-structured questionnaire validated by ophthalmologists was administered to assess the awareness and knowledge. The sample size, based on a pilot study conducted on 50 patients at our center, to estimate 95% confidence interval, keeping 5% absolute margin of error and finite correction, the sample size came out to be 912 patients. So this was the questionnaire which was administered. The initial part of the questionnaire had the demographic data, that is the age, gender, and the educational status. The entry question was whether the patient had heard of glaucoma or not. If not, the questionnaire was taken back and the patient was not allowed to participate in the study. The early 4 questions have tested the awareness, and the latter 6 questions tested the knowledge in the patients. The result analysis was done on the computerized database SPSS version 25. The overall awareness and knowledge was classified as good if the score was above 75%, fair if it was 50 to 75%, and poor if it was less than 50%. Confidence interval kept at 95%, where a p-value of 0.05 was taken statistically significant. Coming to the results and discussion, we had more male participants. So the other studies conducted in the Indian setup also had male participant, and the explanation was that males tend to seek the medical services more than the females. The prevalence of this disease was more in patients aged above 60 years. That resonates with the Barbados study. And the educational status, most of our patients were 12 standard and below educated. So the overall awareness and knowledge was fair amongst our patients, and the age and gender was not significantly associated with the awareness and knowledge. However, educational status played a pivotal role in the awareness and knowledge. So the limitations of a study was we had excluded the socioeconomic status that would have overlooked the potential disparities. It was a single center study. This cannot be, so that limited the generalizability to the other population. The strengths were, it was a well-structured, we used a well-structured questionnaire. We had a large sample size. The scoring system did not overestimate the awareness and knowledge, and this is the only study till date that we know of that has conducted awareness and knowledge amongst patients of primary open-angle glaucoma. So to conclude, we need a targeted educational program, especially for the older age group and those with lower educational level, in understanding the gravity of the disease and the importance of compliance to medication, strict control of IOP, family screening, and follow-up. These are my references. And at this Devbhoomi, I conclude my presentation with this picture of Gateway of Gods, that is Haridwar. Thank you.
Nice presentation.
Thank you.
Did you have the questionnaire in local vernacular language?
Yes, sir, we did have the center was in Maharashtra. The questionnaire was also administered to them in Marathi. The illiterate patients, if they were willing to participate in the study, I had read out the questionnaire. The study was conducted by me, so the patients were made to understand the questions before they answered them.
Did you, like, suppose you have a patient who is a senior citizen with primary open angle glaucoma? This is a suggestion, not a question. You can call the children.
Yes, sir. So while the questionnaire was administered, at least for these 912 patients, they were educated simultaneously, and the emphasis was laid on family screening and the follow-ups. To our surprise, sir, we had actually administered the questionnaire to 1080 patients, out of which most of the females, I don't know, that is why probably the patients participating in the study, the females were lesser, because out of these around 100 to 115 patients did not know of the disease that they were being treated for, and most of them were females. So that was quite surprising. Again, this data is from a government set up hospital, so this is quite expected, but it was quite sad to learn also that the patients are being treated for a chronic disease but do not know what they are being treated for.
Did you follow up with screening and treatment also?
Yes, sir. The subsequent follow up was screening and treatment. They were allotted dates and appointments. They were motivated to come for a follow up, but they were educated enough to an extent in their language. They said they were told that you would go blind or your family members would go blind. They would not know. So for them, the understanding was also कि ठीक है, even if we go blind, lens डल जाएगी तो नज़र वापस आ जाएगी. I don't know, that is the popular notion.
So, but Dr. Sumedha, the onus lies on us. If the treating doctor has not actually talked to the patients, I don't know. It's both ways, right? The patient is not aware that he or she is. The doctor has not told them, or they did not understand it. So the chair time really matters in such patients.
It does, ma'am. It does. Okay. So the onus, the primary caregiver is responsible. So then that is how we came with a. I had just joined that center, and it was my interest that to conduct the study.
But you have a good number, taking into account that it was a COVID period, all the
correct,
2
ma'am.
years that you have taken.
Yes, ma'am. So the glaucoma, the 3 years, ma'am.